a short video to demonstrate the important parts of the lumbar spine. First, here's the body, here's the transverse process, here's the spinous process. And the bit of bone that connects the body with the transverse process is the pedicle. I always think of the P in pedicle as an upside down B that's associated with the B in body. And the bit of bone that connects the spinous process with the transverse process is the lamina. Now, part of the lamina is the pars interarticularis, and that connects the superior articular process, seen here facing inward, with the inferior articular process, seen here facing outward. If you're ever confused with which view of the spine you're looking at, if it's inferior or superior, just remember that the superior articular process is facing inward. So this would be a superior view. And here's the vertebral foramen where the spinal cord traverses. Now let's look at how you would identify which Z joints and which pars you'll be viewing in each oblique view. So let's imagine that the IR is in front of the patient, so this will be an anterior oblique, and now we're raising the left side away from the IR. Notice how the lamina on the right side would now be viewed on end or foreshortened, and the left lamina and pars would be elongated. So the anterior obliques would best demonstrate the Z joints on the raised side. In this case, the left Z joints and pars. Let's look at the posterior oblique. So in this case, the patient's back is now close to the IR. And if we rotate the patient so the right side is now away from the IR, notice how the pars and the lamina on the raised side would be foreshortened or viewed on end, and the pars and lamina on the side close to the IR, in this case the left side, would be elongated. So for posterior obliques, the side that's close to the IR, in this case the left Z joints and pars, will be best demonstrated. So it's not a lot of stuff here, which is why it only needs